Welcome once again, Aldila Beyond Wellness, and Aldi Geldenhuis with me again today. Aldi, it's a well-known fact that the female body changes a lot after childbirth. And Aldi, being a registered doula, will be the expert in telling us about it.
Yes, I often tell the clients, when you fall pregnant, it is a journey that you have to walk. And a soldier doesn't go off to war just with a gun and a backpack. That soldier receives intense training. And if you really understand that your body goes through a 9-month change, and you have not been educated or empowered to look after your body during that time, a lot of women, can I call it, let themselves go, not in a disrespectful way.
At the lack of knowing better.
At the lack of not knowing, disempowerment and not education. And what happens is you are sitting with the aftermath of 9 months of eating for two. And to fix that or to rectify that can be very, very hard. So with me, I like to always say prevention is better than cure. So being a doula is not a midwife. A doula is someone who supports the mother, especially emotionally, supports the father and the family unit emotionally. The midwife or the doctor catches the baby or helps you with the birth process. They are the medical team. Your doula is more your emotional support team, empowering you, helping you with education and knowledge. So when I have clients that come to me that fall pregnant, I even have a preconception plan at the practice.
I was about to ask, does it start there?
Yes, you have to actually prepare your body before you fall pregnant. And then as you are pregnant, we actually have a whole pregnancy integration program that we put you on to help you, because the belief system of eating for two and you can have as much as you want to eat, it's actually not true.
100%
it's not a contribution, and it doesn't have to be that way. I will tell you, my son is 10 years old and I am now 42. I birthed him when I was 32, and my body has been better the last 10 years than it's ever been before, because when I was pregnant with him, I had a midwife. I called her the general, and she clapped me. Let me tell you, I had pregnancy boot camp 101 from the minute I found out I was pregnant. And she helped me, she empowered me, she supported me. So when I birthed, I did not have any body issues because I prepared my body for what was about to happen or what was happening. So in the practice, there's two segments. There is, I want to fall pregnant, or I am pregnant. Aldila, how can you help me? And then I'm sitting with a lot of aftermath when the mothers come to me and say, right, I have not been empowered through my pregnancy. I've gained 20, 30 kilograms. What do I do? Now, there's a joke where the lady goes to the doctor and she says to him, doctor, please help me. I have gained 30 kilograms after my baby and I just can't seem to lose this 30 kilograms. So he said to her, okay, but how old is your baby? And she said, first year at university.
It's about time to lose that weight.
Okay.
But it's also, one must understand that there's hormonal changes in the female body.
Yes.
And some of those hormones tend to build fat or retain.
Yes. So there's a lot of things that can happen. Obviously, all of the hormone surges in the body. The body is preparing itself to expand.
Yeah.
To house the baby, for you to be able to breastfeed the baby, all of that. Again, I'm going to say there's a lot of things we can do before and during the pregnancy to stop most of those things from occurring. However, if you don't know any better and you did not have someone to support you through this, you will come to me saying, I breastfed my child, now I've got stretch marks, my breasts are hanging, I have got a tummy, My tummy is hanging. I've got stretch marks on my tummy. And as we have this discussion, we are going to speak of the female anatomy and even the aftermath of what women are struggling with. And being a doula and working at Hillbrow MOU, it's a fascinating experience. I have got such a passion for women's health and for women's sexual health. And that was the reason for me in saying, right, I've got the integration in the practice. I've got the machines that do the needleless injection therapy. I am a doula. How can I help women to rectify the trauma and the damage that they've gone through in having a child?
You use a very strong word in the sense of damage, but it's actually reversible if one handles it correctly. Am I right?
Yeah. Childbirth is one of the most traumatic things a woman and her body will ever go through. And if you do not have the right support, it can cause great damage emotionally and physically. And that is why we are having this talk today. Yes, we are going to speak about how we can fix the aftermath of birth and pregnancy, but in this specific segment, I want to really reiterate to the viewer, all of this can be managed. All of this can be prevented if you just visit beforehand. So even before you fall pregnant, have an integrative session and go on a program to make sure that you are not overweight. Your body is not filled with toxins. You have your body at a place where it can carry a healthy baby and give you a safe pregnancy or gestation area or era.
You mentioned stretch marks earlier. Is there a way that one can prepare the skin for this and to prevent stretch marks? Because once they're there, they're there.
And the problem with the stretch marks is, and I am going to, in the next week or so, I'm going to start posting the before and after photos. Okay. It took me 6 months now in the practice, introducing all the clients to the needle-free injection therapy. And one of the things that I've gotten the best results with is the stretch mark treatment.
Really?
Yes. Now, a stretch mark, and I don't want to bore the audience, but a stretch mark is a bugger. And you don't always know how your skin is going to react.
Yeah.
So I have got a lot of clients that had their babies, and everybody's skin is different, and the skin has to hold, and suddenly the baby grows quickly and it stretches and it gives in, and then you're sitting with your tiger brands, as I call them. So again, try not to pick up too much weight in the pregnancy. Keep the skin moist, look after the skin, put on the skin oil. All of those things are important, what you eat, how we assist you. But ultimately, if you come to the practice and the aftermath is there, yes, we can assist you. We can treat the stretch marks, we can treat the scarring, all of that can be treated. But prevention is better than cure.
When we look at, I must almost call it a course that one goes through to get your body ready for this. In that period, do we look at maybe reconstructive, rebuilding, fixing up?
Yeah, most definitely.
Now, we all know plastic surgeons love mommies because their breasts start sagging. It's uncomfortable, it's unsightly. How do we fix that?
Plastic surgery cannot fix the texture of the skin. So they can cut away the stretch marks to a certain point, but you're going to sit with scars. So it's important that throughout your pregnancy, you wear the correct underwear, you apply the correct products to your skin, you take the correct supplements, and you eat healthy.
Bottom line.
It can all be prevented through the right support team. That's why I keep saying to the clients, if you want to fall pregnant, come for a conception program. If you are pregnant, come and let us support you through your pregnancy, physically, emotionally, on all levels. As you birth, you have your doula supporting you, and after the birth, we have a post-maternal program that we help you to get your body back quicker after the birth.
Next week, we'll be chatting more about processes and
Yes.
procedures.
And what we can do.
You stay tuned. Next week we'll be back with Aldi Geldenhuis. You stay tuned.